call upon our final speaker for the day. And that speaker today is Claudia Acerbi Rodrigues. So if you are available, Anna?
Yes.
Can I call you Anna for short?
Yes, okay.
Thank you so much. And you're from Brazil?
Yes, I'm from Brazil.
Everything good for you?
Yes.
Okay, well, I'll let you take over.
Wait a minute, please. I am putting my presentation. Okay. Hello, my name is Claudia. I am from Brazil, and I will present my master degree paper. I'd like to thank you for the invitation to this presentation in the conference. Thank you. I am taking off the video. You are here on my voice, okay? This, let me return one, sorry. This presentation is entitled Difficulties in Facing Alone the Demands of Treatment, Experiences of the Hemophiliac Adolescents. My paper was developed to my master degree graduation. I am postgraduate in nursing program from Federal University of São Paulo, and the dissertation was entitled Not Being Able to Face the Demands and Difficulties of Treatment Alone, Experiences and Reasons of Hemophiliac Adolescents. In 2009, I prepared the dissertation, and in 2012, I concluded the paper to conclude the post-graduation. So, talking about hemophilia, it is an inherited and chronic bleeding disorder that manifests almost exclusively in males. Hemophilia is a deficiency of coagulation factor 8 or 9 circulating in the plasma. It causes spontaneous or post-traumatic bruises, especially in musculoskeletal system. The treatment is continuous using the factor concentrate intravenous, preventing sequels and minimizing bleeding time, promoting hemostasis. Requires the participation of patients, their families, and multidisciplinary team to successful prophylactic measures and prevent strained staff-patient relationship. Here we can see the hemophilia coagulation process, where the deficiency of factor interrupts the clot, leading to the bleeding and bruises. Some pictures to illustrate how important is the bleeding in hemophilia patients. Sometimes a little trauma that we can see in persons who don't have hemophilia. mild head trauma in the first picture, an eye trauma in the middle, a tongue hematoma, a leg hematoma, a lip trauma that bleeds a lot, and finally a knee hemarthrosis with the swelling and very much pain. And what led to develop of this paper? Why we studied about the adolescents and hemophilia treatments. So young and so damaged. What led us to develop this paper is to know why they don't adhere with the recommended treatment to hemophilia in our service. And they need to know the reasons why to better suit our work to this population. The aim of the paper was to understand the reasons why the hemophiliac adolescent does not adhere to the hemophilia treatments that can bring benefits to their quality of life. And why specifically adolescent patients? Because they are the population that normally relax their treatment and conducts of care. So, to develop this study, we opted for a qualitative approach. We work with beliefs, values, and the attitudes of the actors, people that we are studying, going deeply into the world of the meaning of the human actions and the relationships too. The symbolic interactionism and the interpretative interactionism were considered pertinent to this investigation. The symbolic interactionism is a perspective of the analysis of human experience and people performing an action based on the meaning that the situation represents for them. And they can redefine with time. The interpretative interactionism recognizes that the meaning of the actions are in the lived experience and mold the meaning people give to themselves and their projects, leaving marks and change the direction of their life. These marks are called epiphanies. The subjects were adolescents registered in the hemophilia service of Federal University of São Paulo, who had not followed the recommended treatment by the multidisciplinary team. The data were collected from October 2008 to February 2009. I made an individual and semi-structured interview with a guiding question. Tell me what leads you to not follow the recommended treatment for hemophilia. And the other questions were formulated based on the speech of the participants and deepening the understanding of the concepts. They related their experiences, their interaction with their body, living with hemophilia, and the process of the treatment. 7 adolescents were interviewed, and we take the results based on their narratives. The four epiphanies that we could understand were having to assume responsibility for the treatment, facing difficulties in implementing the treatment, judging that they do the proper treatment, discrediting the efficacy of treatment and efficiency of the service. According to the method, the stories were intensively analyzed. We made the identification of elements and the key configurations of the discourse. The first epiphany, here in the picture we have at the top the name of the epiphany. On the left there are the elements of speeches, giving us the representative theme, and on the right there are the speeches of the guys. The first epiphany refers to the responsibilities to the treatment. They feel different and excluded from his group of friends because they have to go to the hospital while the friends are doing other activities. Having to assume responsibility for the treatment. Feeling different for being hemophiliac. Starting to miss appointments when they have to come to service without their mother. Getting tired for the routine of coming to the hospital. Feeling lazy to come to the service. Prioritizing other activities. In the speeches they said, my brother and I are different from other people who do not have hemophilia. We cannot do whatever the other boys do, that bleeding can start. Before my mother scheduled the exam and brought me. Now I have to do myself and I forget. It is inconvenient to have to come here when I could be doing something else, like reading at home or at school. The second epiphany faced difficulty in the treatment. This one has different aspects. Transportation, distance to the hospital, financial problems, go to school or working, and wait for someone to take him to the hospital, especially when he is with pain and needs the injection of the chlorine factor and doesn't know how to do the application of the medication that he needs. Cutting many connections to arrive at the service. Having financial problems to go to the service. Depending on the family to bring him to the service. Failing to reconcile the routine of school and work with treatment. Failing to perform home treatment. Their speech. I live very far from here. It's so difficult to come. Sometimes my mother has no money. It's my mother and me alone. When I am in pain, I have to wait for her to come from work to bring me here. Also, I was dismissed because I was a few days without condition to work because of the bleeding. They, the parents, have no courage and neither do I. Distress me, but a needle in my vein. Put a needle in my vein. The third epiphany, Judging that they do the proper treatment refers to the fact of the adolescent considering that he is doing the adequate treatment for hemophilia. Although he does not completely follow it and he knows that it can hurt him. The terms: avoiding to do what can hurt him and performing treatment as soon as he gets hurt. Their speeches. I have had a great understand that I had to stop to fighting and playing football. I almost have no more bleeding. But in my point of view, I follow the treatment correctly. At the time, I am feeling a little pain and I have to calm. If it starts, I already take the factor. The fourth and the final epiphany, discrediting the efficacy of treatment and the efficiency of the service, revealed the disbelief of the adolescent hemophiliac about treatment and the care of the service and satisfaction with another service that he could use. Being poorly attended in the service on weekends. Referring other services. Judging physiotherapy unnecessary. Not valuing the annual exams collection. Describing the perspective of improvement. The schedule on the weekend is very bad. People come and have no doctor. We've been injured with pain and there is delay in waiting to be attended. I've done physical therapy here, but there is better, another service. It has more devices and the girl is over there, seeing if it is right. Why keep doing a lot of tests every year? You know what I have. My leg is now all screwed up, and even physical therapy failed to improve anything. At the time that the bleeding hurts you, it's like death. So we caught the speeches and the themes that these guys said to me. And this picture is a representative form for the paper. And the method asks for the authors to construct one of these. The title in the center, 4 epiphanies around it, and then the ideas expressed by the patients. Concluding or discussing about what we heard of these patients, we heard these experiences of the adolescents, their behavior related to their condition, and why they could not to face alone their demands and difficulties in this period of life. Adolescence is the period that care declining in this population, and we could change something to help him. So it's important the assistance of care to them with continued family support, continued education and developing group activities for social integration. They participated in meetings where they experienced exchanges of ideas, had fun, and received the educational opportunities. We reorganized the service as for reduced waiting time to attend when they are in pain or needing care at night. We received more physiotherapy equipment and multidisciplinary team able to deal with adolescents and their families. Were established social policies related to transport or public transportation and the labor rights to facilitate their lives. Our social worker and the hemophilia support house worked hard to help them, and it was successful. The commitment of involved with the improved to hemophilia care to improve the quality of life of this population, including Ministry of Health, including Brazilian Federation of Hemophilia, including World Federation of Hemophilia, the multidisciplinary team, and patients and their families too. Thanks a lot. I have here some references that you can enjoy to deepen the text. Thanks a lot.
Well, thank you so much, Anna Claudia. That was extremely informative. Hadn't actually done any research on haemophilia, but that's my bag. Could I ask the audience, are there any questions to be posted at this moment in time?
Yes.
Are there any burning desires to understand a little more from Anna Claudia today?
Okay, I am hearing you.
If there's no questions, it is my pleasure then to just thank everybody, and the last Claudia as well. Thank you very much for your presentation. It was very informative and very applicable, because we do come across hemophilic patients, and now we know what is happening in their world and how do they feel.